It all started with one seemingly harmless trip across the border, exclaims a distressed resident from a small, distant place called Wonowon in northern British Columbia. Who would have thought that a routine journey could spark a chain reaction of rising panic? Welcome, everyone, to today's deep dive into one of the most surprising and urgent health incidents unfolding in our time. A measles outbreak in northern British Columbia that has medical professionals racing against the clock. What in the world is truly going on here, you might ask? Why would a modest community, located about 90 kilometers away from the city of Fort St. John, suddenly become the epicenter of a quietly explosive event that has thrust fear and fascination onto the provincial stage? In this extended report, we will explore how a handful of cases turned into 20 suspected and confirmed incidences of measles, why the surrounding areas are braced for more, and what lessons many communities can learn when it comes to disease preparedness and the importance of vaccination. From the subtle clues that first led doctors to suspect the disease, to the far-reaching consequences for families caught unawares, we will delve into the many layers behind this story. Prepare to have your assumptions challenged as we examine how a small patch of northern British Columbia could potentially teach the entire nation, and even the world, lessons about vigilance, communal responsibility, and the shaky line between complacency and chaos. Are you ready? In this episode, we will peel back several critical questions. Does this outbreak reflect an even bigger issue lurking beneath the surface, not just in British Columbia, but across Canada? How on earth did Ontario end up logging thousands of confirmed and probable cases? And why are Alberta's statistics also raising eyebrows? And perhaps the most pressing question of all, can communities located in rural and remote areas truly keep themselves safe from a disease as notoriously contagious as measles when population immunity might be less robust than expected? There is so much to uncover, and I invite you to stay tuned to the very end of this deep exploration. We begin with the place at the center of it all, Wonowon, a community so little known that many maps tend to overlook it. Tucked away near the Halfway River First Nation Reserve, this area has been living life at its own relaxed pace, well away from the hustle and bustle of British Columbia's southern cities. But beneath this seemingly calm exterior, health workers noticed unsettling clues a few weeks back. Someone had been feeling feverish. Another person exhibited an odd rash that was suspiciously red and blotchy. Soon, local medical facilities found themselves faced with multiple patients displaying symptoms that were suspiciously similar. That is when alarm bells started ringing. Experienced doctors and nurses recognized the early signs of possible measles. If you are unfamiliar with this disease, measles is not some quaint, old-fashioned relic. It is considered one of the most contagious illnesses known to humankind, able to spread through the air in confined spaces and easily passed from person to person just by coughing or sneezing in close proximity. Even those robust enough to handle a typical bout of flu are not necessarily in the clear with measles, because in more severe cases, it can lead to pneumonia or inflammation of the brain. Left unmanaged, it may prove fatal. Once local suspicions were confirmed and the disease identified, the unstoppable domino effect had already gained too much momentum. Health officials, including the Chief Medical Health Officer for Northern Health, stepped forward to warn. The number of infected individuals had soared to 20 suspected and confirmed cases. District-wide bulletins urged everyone to verify their vaccination histories, reminding families that susceptibility could lead to serious ramifications. Here lies the heart of the drama. Even though many Canadians, particularly in larger cities, might assume measles was a threat banished to medical history books, the disease has been steadily re-emerging in pockets across the nation. In Ontario, for instance, over 2,118 confirmed and probable cases were recorded at a certain point, prompting significant concern from epidemiologists. The same is true for Alberta, which has been grappling with ongoing clusters of new diagnoses and the implications of that for both families and healthcare systems. And now, not only is British Columbia not immune from the trend, but it has been jolted by its own unexpected crisis in a region that was, until recently, genuinely off the radar for something this dramatic. But how did this even happen here, one might ask? A central theory, supported by stories circulating among local officials, is that someone from Wonowon traveled outside the region and unknowingly brought the virus back. Because measles is so contagious, it only takes a single carrier to be in certain public environments before others can be infected. The initial traveler may not have realized the seriousness of early symptoms, or perhaps they were simply unaware of their immunization timetable. By the time that person came home, the spark had already caught, and the infection chain was ready to begin. One crucial factor complicating matters is that many folks in the area might be uncertain about their immunization status. Vaccination credentials, particularly older documentation or those acquired by families who settled in the region from elsewhere, can be incomplete or unclear. The advice pouring in from Northern Health and the British Columbia Centre for Disease Control is crystal clear. If you are not sure whether you are fully vaccinated against measles or have had the infection in the past, do not hesitate. Talk to your healthcare provider, not tomorrow, not next week, but right away. Now, you might be wondering, can one little rural town's outbreak have national implications? Absolutely. Even in the far-flung corners of Canada, individuals regularly travel between communities. Peace River residents might set out for a trip to Vancouver or cross the provincial border for work or recreation. That movement, multiplied by families, truckers, tourists, and more, can magnify the spread of infection faster than you might imagine. The British Columbia Centre for Disease Control reported that their official tallies place the total number of suspected and confirmed measles cases in British Columbia this year at 32. Who can say if that number will grow? As officials caution, the actual number of infected individuals could be even higher than what has been verified thus far, because some folks are hesitant to seek formal testing or might pass off symptoms as a mere cold. Not surprisingly, some of the phenomena we are seeing here echo larger global trends. Every so often, measles rears its head in certain regions around the world when vaccination rates fall below a crucial threshold. Although many childhood immunization programs have done wonders to control or even nearly eliminate diseases like measles, it remains a threat if a significant cluster of the community is not vaccinated. Health specialists frequently point to what is called herd immunity. If a large enough chunk of the population is immune, experts frequently cite a benchmark approaching 95% for measles. This forms a protective barrier that can block the rapid spread of the disease. But if vaccination levels dip, that protection wanes, opening the door to swift outbreaks. Now, let us talk about the nature of measles itself. This is not your run-of-the-mill mild virus. Measles typically makes itself known with an exceptionally high fever, often in conjunction with sneezing, coughing, and a distinctive rash that does not always appear right away. Sometimes, small white spots develop in the mouth. One of the reasons it is so contagious is that even before you realize you are sick, you can be busy passing it on to those around you. And, in worst-case scenarios, individuals can develop secondary infections such as pneumonia or even experience life-threatening complications, particularly if they are very young, elderly, or have compromised immune systems. Picture, for instance, a family that has never worried about immunizations because they believed measles was a dusty antique of an illness, something that might have been problematic for grandparents in earlier times, but no longer relevant in the modern era. This could be exactly the kind of household that finds itself blindsided when an active measles case arrives in the neighborhood. Suddenly, a supposedly outdated disease becomes alarmingly real as doctors caution, quarantine, or avoid public spaces if you are displaying any symptoms. This can be hard to accept for parents with small children or breadwinners who rely on daily work. But ignoring expert advice can accelerate the region-wide spread of disease. It becomes even more complicated when you consider the cultural richness of places like Wonowon. According to available reports, the community has a diverse linguistic population, including families who speak Russian or German and who might prefer medical advisories in languages other than English. Then there is the nearby Halfway River First Nation Reserve, with around 300 individuals possibly connected to the broader social circle of the region. If crucial health information does not reach certain segments of the population, either because of language barriers or geographical remoteness, there is a higher likelihood that some local people remain unvaccinated and unaware of how to spot early indicators of measles. But how has the rest of Canada reacted to the flip side of the coin? Cities like Toronto and others in Ontario have recorded over 2,118 confirmed and probable cases of measles in recently documented reports. That is an astonishing figure that belies the commonly held belief that measles is only a third-world problem or an affliction that belongs in old black and white photos. Meanwhile, Alberta has also documented rises that keep health teams on high alert. Experts say some communities in Canada have indeed grown complacent, partly because so few remember the time before widespread vaccine usage, when outbreaks were more frequent. Yet, as we are now seeing, complacency can give way to a perfect storm for the virus to surge. Right here at the midpoint, let us pause to highlight a crucial takeaway. For anyone invested in exploring deeper stories like this, let your curiosity and your sense of responsibility lead you to consider how health crises can spring up in the most unsuspecting areas. And if you are enjoying how we are dissecting this baffling situation, feel free to support this channel with a quick gesture. Maybe consider dropping a like right now. That little bit of engagement can let us know that you find these extended, in-depth discussions genuinely valuable. Now, let us switch gears and discuss the significance of 2 doses of the measles, mumps, and rubella vaccine, commonly referred to as MMR. It has long been established that 2 properly spaced doses offer an extremely high level of protection. Some studies have pegged it at about 97% or more. For the extremely cautious, there is also the measles, mumps, rubella, and varicella vaccine, shortened to MMRV, which tackles the varicella virus, causative agent of chickenpox, in tandem. Yet, in a region like northeastern British Columbia, officials warn that immunization rates are still below the threshold needed for guaranteed herd immunity, meaning pockets of people remain vulnerable. As the story vividly shows, it can take only one spark to ignite a wave. So, what happens when you are in a small place like Wonowon, or the Peace River area, and you find yourself with the dreaded rash? Officials are advising immediate self-isolation, particularly within the initial 4 days when one is most likely to spread the virus. They also encourage families to phone ahead before visiting a doctor's office. This allows healthcare teams to prepare so that the infected person does not inadvertently expose other vulnerable patients. Under these circumstances, communication is key. A single phone call can be the difference between an isolated incident and half a dozen additional infections. To give you a glimpse of the on-ground reality, local hospitals, especially the Fort St. John Hospital, are on heightened awareness. A potential exposure period was flagged for individuals who visited the emergency area on a certain date, and public advisories urged them to keep an eye out for measles symptoms over the subsequent few weeks. Remember, it can take up to 3 weeks for symptoms to appear, which means many families are anxiously waiting to see if coughs or runny noses transform into something far more menacing. Perhaps the biggest takeaway from this entire saga is that measles is about so much more than a rash or fever. It underscores the delicate balance between personal freedom and collective responsibility. The question resonates. Should Canadians feel a communal obligation to vaccinate not just for their own children's sake, but to protect neighbors who might be immunocompromised or too young for vaccination? Public health professionals say yes, reminding us that free riding on others' immunizations can backfire spectacularly if too many people choose not to vaccinate. The unvaccinated population then becomes large enough for the virus to spread with alarming ease. We should now consider another point. The modern era has created an abundance of information, but not all of it is scientifically credible. While some parents fear rare side effects of vaccines or question whether the benefits outweigh the risks, conservative estimates from the World Health Organization highlight the life-saving impact of vaccines worldwide. They remain arguably one of the best defenses humanity has against certain infectious diseases. Government health agencies in Canada also frequently emphasize that the MMR vaccine has been used extensively for many decades, illustrating a robust safety track record. You might be wondering whether the outbreak is subsiding or if it may yet escalate. Doctors are keeping a close eye on developments. They also caution that the real count of measles cases could be higher than 20 in northern British Columbia at the moment. Not everyone seeks medical care straight away. Some might attempt to wait out symptoms, and others may be isolated in remote pockets not regularly traveled by healthcare providers. Measles is not only extremely contagious. In certain circumstances, it tends to pop up in clusters. If an entire household or a tight-knit community group has not been vaccinated, that cluster could swiftly turn into dozens of infected people. Supporting the local population in times of crisis is key. Health teams are offering vaccinations, including the MMR and MMRV shots, and encouraging exposed people to talk with their doctors. While a single injection after exposure might not fully prevent a case of measles, it can potentially lessen the severity of the symptoms or even forestall infection if done promptly enough. Meanwhile, Those who cannot get vaccinated for legitimate medical reasons rely on those around them to help sustain that vital protective threshold. That is why officials are essentially pleading with communities around the province. Check your records, talk to your parents, grandparents, or whomever else might know your health and vaccination history. The more people that get immunized, the safer the entire area becomes. In Ontario, doctors believe the spike in measles could be attributed to similar vaccination gaps, as well as the typical wave of international travel that brings individuals in and out of major urban centers. Much like northern British Columbia, Ontario's networks of smaller towns, suburban communities, and farmland can be more vulnerable if the overall mindset is that measles is a problem from yesteryear. And in an interconnected era with highways, airports, and bus routes bridging the largest city to the tiniest hamlet, no region exists in total isolation. Back in the Peace River region, local parent groups are swapping stories and clarifying vaccination schedules among themselves. Teachers in the local Wonowon school, which currently counts about 8 sick students, are handing out notices urging parents to check their children's potential susceptibility. This can feel daunting, particularly for households that speak a different first language, or for families that choose to live a more self-sufficient lifestyle, but the possibility of heartbreak if a child becomes gravely ill is unimaginable. Therefore, medical authorities are ramping up every form of outreach they can think of, from phone hotlines to in-person vaccination clinics. But there is also a sense of quiet resilience among the folks who call places like Wonowon home. Many people in rural areas have faced difficulties before, be it harsh winters that cut off roads or unexpected accidents that strain minimal local health resources. Neighbors often come together, sharing transportation and ensuring that elders or those with limited mobility get the care they require. That same spirit of collaboration might prove essential in halting measles in its tracks. If anything, the resurgence of measles, whether in northern British Columbia or Ontario or other parts of the world, might serve as a wake-up call. Past generations learned the hard way that certain diseases cannot be taken lightly. Vaccination programs were considered a modern miracle, drastically cutting the rates of once common pediatric deaths. However, what may happen if younger people, or society at large, forget how dreadful these diseases can be? The moment fear of the disease disappears might be the moment underestimation paves the way for a new outbreak. We stand at a compelling juncture. Lessons from Wonowon, from the Peace River area, and from the broader region converge into a clear message. Complacency is the real enemy. Because measles is stealthy and unrelenting, you do not need an enormous population to amplify its spread. Just a few families who are unaware or unprepared. Health officials across Canada caution that, while the immediate problem might be contained with diligent contact tracing and swift immunization drives, the problem will never truly vanish without consistent vigilance. So, what can the average person do? First and foremost, verify your immunization records. Second, if you are a traveler or someone who works across different communities, be mindful of how easily these diseases can hitch a ride with you. Third, consider lending your voice to encourage neighbors or relatives who may be on the fence about vaccines to have a conversation with their healthcare providers. Scientific facts and open dialogue often dispel misconceptions that might otherwise linger in an information vacuum. And as we reach our second peak moment, if you feel that staying informed and being prepared is immensely valuable, then why not consider joining our community as a subscriber? By doing so, you ensure that these important stories and potential calls to action do not slip through the cracks. We delve into topics that matter, offering a space for curiosity and learning. We welcome you to come along for the ride. From one vantage point, the current measles outbreak numbers in northern British Columbia might seem modest, only a couple dozen suspected and confirmed cases. But the larger context reveals a microcosm of what might unfold in other parts of Canada or beyond should we allow immunization rates to dip or remain stagnant. It is not just about one rural community or a single city exposed to this virus. It is about the ripple effect that can disrupt health services, cause anxiety among families, and remind us how diseases once presumed tamed can roar back all too quickly. In concluding this sweeping overview, it is fair to say no one expected a low-profile travel journey to spark anxieties of a local outbreak, nor did anyone predict that tiny Wonowon would become a focal point in British Columbia's health bulletins. But the people of northern British Columbia are determined, and their experiences are swiftly galvanizing local leadership, prompting thorough contact tracing, robust immunization campaigns, and serious warnings to keep vigilance levels high. We have covered a lot of ground, from the initial shock of an unsuspecting measles case to the vaccine strategies that could make all the difference in preventing future outbreaks. We have looked at how local communities, doctors, and health officials are facing the unfolding crisis, as well as how events mirror the broader struggles in Ontario and Alberta. We have uncovered how swiftly a disease can infiltrate otherwise quiet regions, uniting a population through a shared concern for health and well-being, even if the affected community sits miles away from the province's most populous centers. By focusing on the details, from the importance of a single phone call before going to the hospital to the collective power of a widely immunized community, we hope this story has brought new insight and context to how precarious public health can be. The final question is, will the lessons learned in northern British Columbia, lessons about vigilance, swift action, and communal caring, resonate across Canada? Only time will tell, but the moral is plain. If a powerful adversary like measles emerges in a humble place like Wonowon, it could just as easily show up next week in your neighborhood, school, or workplace. The old saying that no man is an island takes special relevance when you consider that an invisible virus can hitchhike across regions without pause. As you reflect on this, think about whether you have spoken with your healthcare provider recently, or if you have ever dug into your past immunization records buried in some dusty box. Germs do not wait for convenience. Thank you for staying with us through this comprehensive exploration. The fight to contain measles in northern British Columbia might be contained for now, but the underlying issues, vaccination rates, education, fast emergency response, are all ongoing narratives. May this serve as a reminder that the health of every Canadian is interwoven with the health of the broader community. Vaccines make up one of our most formidable defenses, and we must never be lulled into believing that outbreaks only happen elsewhere. Stay safe, stay aware, and remember that even the most remote corners can become ground zero for an alarming spike in disease. That is what is happening in Wonowon, so let us all keep watching, learning, and acting when necessary.